We will begin our program by remembering seniors who have passed away recently. And they are John Radcliffe, advocate for death and dignity. John received our Shining Light Awards in 2017. Also, Rose Nakamura, co-founder and administrator for Project Dana. Rose received our Shining Light Award in 2018. Also, Nanette Geller, advocate for geriatric mental health and coordinator for Green Wheel Food Hub. And Breen Haramoto, Senator, Hawaii State Legislature. That we will be have just a moment of silence at this time. Okay, thank you.
Justin, why don't you do the introduction, please?
Okay. Welcome to the 14th Annual Legislative Review, The Good, Bad, and Ugly, sponsored by the Hawaii Alliance for Retired Americans and Kokua Council. However, because of COVID-19 this year, the legislative session was extended to this summer. As a result, this event is being held in October utilizing Zoom. On behalf of HARA, I would like to thank all the legislators and participants who are participating in this legislative review. At this time, I would like to introduce Lila Mower, President of Kokua Council.
Thank you, Justin. On behalf of Kokua Council, Ekomomai, I welcome the legislators and audience who are joining us today. I'm Lila Mower, the President of Kokua Council. Like our valued colleagues in the Hawaii Alliance for Retired Americans, Kokua Council is known for our focus on kupuna. However, we also advocate for and seek to empower others who are disadvantaged or marginalized. In early March, when the governor declared a state of emergency and shut down nearly all businesses and social activities to halt the spread of the virus, understandably, the priority was survival. But it quickly became apparent that this initial reaction was inadequate. While the government stalled, there was an organic groundswell to organize PPE drives, to create masks and materials at home, and for local distilleries to create hand sanitizers. Neighbors and faith-based groups collaborated to organize and supply food drives and distribution. All strove to ensure that our community's basic needs were met. Unfortunately, resources began to dry up. Supply lines slowed to a trickle. The loss of jobs spread even more quickly than the virus, and many of those who served as donors eventually joined the long lines they previously served. By August, it was apparent that the government did not have a comprehensive contact tracing strategy. Kokua Council pursued legal action to assure statistically adequate numbers of contact tracers and to protect marginalized communities. The vision of Hawaii's Recovery and Resiliency Navigator for our path forward centers upon an enhanced testing to use as a screening tool to safely reopen businesses, schools, travel, and tourism. But defunct businesses, unemployment, lives altered by loss, and other painful consequences cannot be restored with more efficient detection or even by a virus. To borrow the words from a healthcare system, it was evident that we needed to do more than just survive. We need to thrive. During the last 7 months, Kokua Council held public forums via Zoom and Facebook, being the first to hold a public forum of Honolulu's many mayoral candidates, the first to hold a public debate of Steve Alm and Megan Kao, and the first to hold a public debate between Keith Amamiya and Rick Mangiardi. We also held public forums to focus upon the vulnerability of care and nursing home residents and their caregivers, and to introduce Honolulu district candidates to their constituencies. During this period, Kokua Council had meetings as frequently as twice a week to ensure that our members and affiliates participated in, were educated by, and were kept abreast of our activities. Thus, you should not be surprised that we are disappointed that the governor suspended a long list of statutes in the name of emergency powers. The suspension was supposed to expire in 60 days, but has been extended many times over. That meant that the state procurement code was suspended and agencies are not required to go through any competitive bid process. And Chapter 92 regarding the public's access to government records was also suspended. Some of these government powers hindered citizen participation oversight, and by suspending transparency, the public's already fragile trust in our government worsened. Regardless of the invasiveness of the virus in every facet of our lives, this is still America, where we citizens have valuable rights that must endure. And this is Hawaii, where aloha, kokua, pono are not merely beautiful concepts, but guides which must permeate our government's actions and edicts. Legislators, you were voted in by your communities to lead us regardless of circumstances. As we review the 2020 legislative session today, we hope that you will also share your forward-looking visions with us. Mahalo for the time that you will be spending us. Let me turn this back to Justin Wong.
Okay, in this part of the program, we have an overview of the 2020 legislative session. Our speakers on this part of the program are Senator Ronald Kouchi, President of the Senate. Senator Kouchi represents Kauai and Niihau. Also, Representative Scott Sankey, Speaker of the House of Representatives. Representative Sankey represents Makali, Kaheka, Kaka'ako, and Downtown. Representative Nakashima, Vice Speaker of the House. Representative Nakashima represents Hamakua, North Hilo, and South Hilo. We'll begin with Senator Kouchi, followed by Representative Sankey and Nakashima. Questions will follow.
Thank you very much. The greatest challenge is simply the legislative process is a very people-oriented business. People have the opportunity to come to the Capitol, schedule the appointments, attend the hearings, and share ideas and convey their thoughts about what they would like to see happen. And in practicing proper social distancing, it's been a real challenge to be able to get that. Now, it's impressive all of the things that you have done at the Kokua Council and First Ofs in Zoom. And as we're doing this meeting, all of us have used this technology. And as great as it's been to have an ability to connect in this way, it sure cannot make up for the individual meetings that we had and the personal contact you were able to use. And certainly for AARP, we miss seeing the red shirts that would always be filling the hearing rooms. But we had last Thursday our first committee hearing in the Judiciary Committee in the confirmation of judges, where we are now with enough bandwidth and capacity to take remote testimony and not just have the senators participate and do votes remotely, but have the public participate remotely. One of my concerns has been, even when we return to an opening of the Capitol, it will not mean that the virus is gone, and not just in the Kokua Council or AARP. You mentioned John Radcliffe. Many of the lobbyists who come here and advocate for different groups are 60 years or older. In a few weeks, I'll be 63. We're all in a vulnerable category, and some people may not feel comfortable for their own personal health to return to the public setting. And so it's our hope that we will be able to accommodate you in the way going forward, to participate remotely, to make sure your voices are heard and you continue to be part of the process. I, could talk about some of the other things, but we've deployed the CARES money, and I don't want to take away from Senators MORIWAKI and Baker, who are going to give a detailed report. It just seems like lately, every time I talk to AARP, the Kokua Council, and different groups, something has happened in my life that, I share because I certainly know firsthand what's going on. I would simply tell you, on Sunday evening, my mom fell in her garage with osteosporosis, broke her right arm. She's right-handed, badly enough to be taken to the hospital, and had a pin inserted surgically on Monday and is challenged to feed herself. I live 2 blocks from Wilcox Hospital, but of course, with the protocols with COVID, non-visitation, so we're experiencing firsthand the difficulty of having a member of the family in the hospital. She's not in end-of-life situation, and so in the abundance of caution, you don't go in, you don't try to spread any germs within the hospital. And this afternoon, she will be moving from the regular hospital to the long-term care facility, which is even stricter in their protocols. And even though Kauai has a fantastically low number as far as infections, they are making sure they stay that way. And we have certainly seen the devastating effects when COVID-19 gets into other assisted living facilities and what can happen. And so, I think one of the most important things we need to do is continue to ensure that we do the necessary testing, the contact tracing, the precautions. And the best thing that I did the day literally that we shut down the Capitol on March 19th, I had a request from Senator De La Cruz to create the COVID-19 committee. It's comprised of 6 members of the Senate, chaired by Senator De La Cruz, Senator MORIWAKI, Senator Favela, who are on the call, are members of the committee. And to meet the transparency, they have held meetings, publicly broadcast, and I think that the COVID-19 committee has done an incredible job of getting information to the public, especially when none was being transmitted. The Speaker's committee has been broadcast as well. And in that regard, I think that the House and the Senate have tried to bring the information to the public. And certainly the work of the COVID committee walking across the street to the Department of Health brought to a head the issue about not having enough contact tracers and getting the action that we needed to go forward to try to ensure the safety of our community. And I'll stop right there and just thank you very much again for all of the efforts you make to make sure we're connected.
Thank you. Justin, I don't see Representative Saiki on the screen.
Okay, why don't we move to Representative
Nakashima.
and we'll take on Representative Saki later. Okay, Representative Mark Nakashima, Vice Speaker of the House. Representative Nakashima represents Hamakua, North Hilo, and South Hilo. So, Representative Nakashima, you're on.
Representative Nakashima, you need to unmute yourself, please.
Okay, how's that?
Very good, thank you.
Okay, all right. Yeah, thank you, Justin, and thank you, Kokua Council, for the good, the bad, and the ugly. I hope I'm not the ugly part. Since March, when the COVID really hit the state, life has definitely been different. The legislative hearings were members only, and we had written testimony, but it doesn't really reflect the true flavor and participation of the public. at that point. And I think we will need to find ways to allow more spirited discussion and debate coming up in the next legislative session. As we step back in March to reassess where we were and the things we were looking at, the legislature kind of developed three goals. One, to revitalize the economy. Second, to deal with the pandemic. And the third, to reinforce the safety nets, those social programs that help people during hardships. So, when we look at revitalizing the economy, we've passed legislation this year that looked at retooling and revitalizing the workforce to expand our economy in ways that had not been expanded before, or to put emphasis in things like forestry, agriculture, and the like, to retrain people in those areas. Also, as we dealt with the pandemic, we set up programs for contact tracing, travel screening, and increased testing. And all of those have done pretty well, but really need to be much more aggressively used if we are going to be able to really bring down the numbers significantly. I think the Senate really did a lot to uncover the reality of contact tracing in the background. And now I understand that the problem that the contact tracers are having are with the unwillingness of the public to be open and honest about their contacts and their relations. And so, that is really a drawback in terms of being able to really effectively use contact tracing to try and stem the exponential growth of the pandemic. And so, the things that we need to look at are how we can improve the contact tracing program so that they are able to get more answers from the participants and those who have been afflicted with the coronavirus. Increased testing, I think, is something that we have seen. However, a lot of times I find that the testing is a little behind the curve still. Instead of going out and finding new areas of infection, we are often testing often uncovers existing clusters. And so, recently here on the Big Island in West Hawaii, University of the Nations was a cluster that had grown to 40 people, and it had not been discovered until very late in the growth of the cluster. And so, we announced that there are 46 people, but it took days and weeks for that to occur. And if we are much more aggressive and a little more proactive in terms of the testing, then I think we would be much more able to curb the growth of the disease. Finally, the safety net policies that we looked at early on, the House led the way in terms of moving the call center at the Hawaii Convention Center to start dealing with the many calls and questions that were coming into the state for unemployment insurance applications. Also, the other things that we looked at during the legislative session was to be able to provide monies for the rental housing program, to make sure that SNAP was reinforced, and to provide for the childcare needs of workers and parents, so that if they were able to go back to work, they were able to do that. So those are the types of things that we did during the session and after the session to try and help the community to make it through this crisis. And I look forward to any questions that you folks have. I won't touch about too much on the Kapuna package, because I know Representative Takayama is here, and he definitely is much more abreast on those issues than I am. Thank you.
Okay, I don't believe that Representative Saiki is with us yet. So can we move to questions now?
Yes, please.
Okay, the first questioner is, let's see,
Al Hamai.
El Hamai. Okay, go ahead, Al.
I'm Al Hamai. I'm the past president of HARA and also a HJ retiree. My question is, what is the leadership doing to deal with the tremendous shortfall in state funds due to the pandemic, and then its impact on the budgeted, Kapuna care funds that we have in the budget? We're anticipating cuts in these kinds of programs. These are safety net programs.
Well, Al, this past year, the governor's major tool in dealing with the budget seems to be furloughs, and the legislature, at least on the part of the House, Representative Luke has been discussing with the governor many other types of things that could be done to keep money on the table and able to be used to meet the budgetary shortfalls. I don't have the details on all of the different tools that Representative Luke brought to the discussion a couple of weeks ago regarding ways to deal with the budget shortfalls. However, I do know that we are looking at different and alternative methods for dealing with the shortfall, and not just doing things like 10% across the board or something like that. That is really the easy way out, and not really looking at the issues individually and weighing the importance of those issues to the community.
And I guess on behalf of the Senate, the first thing I would say, which I forgot to say in my opening remarks, is hello to Jean Dobashi. Nice to see a Kauai resident on the call and a voter in my district. So I want to be sure I say hi before I proceed. Although we don't want to just do 10% across the board, I think that it's a good benchmark for everybody to understand the severity of the budget shortfall. And if we were going to do an easy to understand balancing of the budget, that's what it would take. Now, all of you have experience in maintaining budgets, whether in your professional career and managing your home. If we're not going to take 10% from one pot, that means that somebody's going to be giving 15% so that you're giving 5%. The number we need to get to is $1.4 billion, and no matter how you want to look at it, you know, you need to get there. And so, you know, absent that cut, then, you know, we'll see what we can come up with. But I can tell you in one area we're looking at is some of the general excise tax exemptions, and do we have to perhaps, you know, lift them? Back in 2011, we eliminated 43 general excise tax exemptions to deal with the budget shortfall during the Great Recession. But just understand, there isn't going to be a single easy choice that we have ahead of us. I believe that the solar tax credit is worth about $65 million right now to the state of Hawaii. If we want to get $65 million to shore up the budget and say we're eliminating that tax credit, as you know, the whole solar industry, the environmental green community, all come out in force and say, oh no, but you can't cut that one. And every interest group will be saying, like you, Al, you know what, but ours is the most important program that we have. And our greatest challenge is that all sources of funds, including federal funds, human services for about the last 3 years has surpassed education as the largest chunk of our budget. But now with human services and education as the largest amount of the budget, you know, how much is left in the other agencies for us to cut to make sure we're not impacting on the educational opportunity for our children in the state of Hawaii, and how are we going to make sure we don't impact the safety net? The other hope I hold out, and I, you know, make no bones about being a Democrat, I hope we're successful on November 3rd. I hope that that partisan gridlock is going to go away in Washington, D.C., and we're going to have some reasonable conversations about what help that state and county governments need that has not been given by the federal government, that would allow us to make sure the most vulnerable and our children are going to be supported in the way that they need to, given the COVID-19 you know, problems that we're dealing with. We have authorized the governor to borrow up to $2.1 billion from the federal loan program. However, that program needs to be paid back in 3 years. Right now, we're looking at a 4-year projection of a difficult climb back in the economy. So we won't generate enough money to pay that loan off in 3 years. The governor feels comfortable to possibly borrow $750 million and make $250 million a year payback. So we are looking to avail ourselves from using the federal loan program as well to mitigate the impact on safety net programs and education. And I know Chair Luke, Chair Dela Cruz, the Speaker, and I have been in conversations to see if there's other ways besides furloughs to get to where we're going. If we're going to rebuild the economy, we need everybody at work to process permits. We have so many frontline defenders. All of a sudden, our custodial staffs are some of the most important employees that we have to ensure that facilities are clean and safe, and we need them to be at work doing those jobs. And how do you wind up reducing educational time from students who are challenged in 100% distance learning right now? So those are, you know, certainly at the top of mind. And the Speaker, as I say, the 2 money chairs and myself have been in conversations, and we certainly know we need to work together and be cooperative to solve the problems that we're faced with.
Okay, at this time, we have another question from Phyllis Hiramatsu.
Hi, I'm Phyllis Hiramatsu from HARA, and also a retiree of HGA. And I have a following question. The state apparently has a lot of money they need to use before the end of the year, and those funds were from the federal government. And I thought the following programs could use more funds, especially trainers to help spread the benefits of this program to the various organizations and especially the senior facilities and the long-term care ombudsman's office. They need to have more personnel to help trace and find out what's going on in the care home facilities. And I would appreciate a comment on those issues.
At this point, some of the money is to make sure that they upgrade the IT or technology for all of the facilities to create the database that ties back to the CDC. There was $50 million of which the money was deployed. Part of the problem is the CARES Act has restrictions on some of the things that we can actually spend the money on, and you can't go into do things in the budget that didn't exist before March 15th when the pandemic hit. So we are trying to make sure that we upgrade, as you see from the reports when we finally uncovered the contact tracing. Many of them are sending information by fax. We don't have electronic records, which would all improve the services that we're getting at the long-term care facilities. As far as any additional help to the ombudsman, that is not something the governor had prioritized in the budget, but I'm not sure that that was actually eligible under the CARES Act for expenditure. And the other thing, when you use CARES money, it expires on December 31st. So if we put something in, then it would be done by December 31st. And I don't know that you can ramp up, hire somebody and have somebody interested to come to work for 2 or 3 months, knowing their position was going away. And the IT investment is something that would last for years going forward.
Thank you very much.
Would you like me to ask my question now, Lila?
Go ahead.
Okay. Hi, I'm Kathleen Wyatt. Tension between the two branches of government, the legislature and the administration, cannot be a good thing. What efforts are being made to establish a more collaborative relationship? Or does the legislature believe that exposing deficiencies is the best way to get things done? Contact tracing and UI, for examples.
Mark, do you want to go ahead first?
Okay. Thank you very much. I think the House has developed a collaborative platform in our COVID committee that is really trying to bring together the community and the best thinking in terms of ways to handle different situations that arise. So as early on, as we were looking at reopening the economy, the COVID committee came up with a scale provided by Dr. Mogoishi regarding the steps we would need to take to start to reopen our economy, and that was a good guideline for what eventually did occur. And so I think that we try to be a little more collaborative. I think there is some difficulty in that because often we provide input and discussion with the governor, but it does not seem to be taken with any type of seriousness that we think that our contributions should bring. And so those are some of the difficulties we are facing in terms of trying to be able to work with the administration in a positive manner.
And I don't think, Kathleen, from my standpoint, not so much that they aren't taking us seriously, but there is certainly some frustration at the urgency. And when we see the problem that exists and we have the conversation and it's gone on for several weeks or a month and nothing has happened, you know, how do you ultimately get it? I find your question just a little bit ironic when I listen to Lila's opening that you have sued the governor because of your frustration with the contact tracing. And is that kind of friction from the community really helpful and good? Well, what else can you do if nobody's listening to you? I was elected to represent the people of my district, and as a state legislator, the people of the state of Hawaii. I was not elected to rubber stamp everything the governor did and agree with him 100%. I have collaborated on many issues. The speaker and I meet with the governor regularly. House leadership has a meeting that they have with the governor. Senate leadership has a meeting with the governor. I could give you copies of emails that I have sent his chief of staff since March, asking about contact tracing, informing them that Tripler Hospital or the DOD had 40 contact tracers available, but they need a written request for the military to step in. The National Guard asked since April, I asked since March, to utilize Guard personnel to do contact tracing. I talked to Presidents Babington and Gotanda at Chaminade and HPU, who had between 100 to 200 nursing students that they were ready to commit. And I had been on and requesting that since March. The COVID committee had been asking it since March, and we were told, we've got this, we've got this. Then the numbers ran away, and all of a sudden they started saying it wasn't important. And so I don't know that there was any other alternative in that case but to come forward, go over to the DOH, personally see it. And so I would hope that these are isolated incidents and we would be able to work collaboratively. But I will assure you, if we are not getting the action we think the people of Hawaii need to be safe and secure, that you can count on us to stand up and be the voice for all of you. In this case, we're behind you because we did not file suit against the governor, but we have walked in demanding action at the office itself.
Okay, we have another question from Lourdes Scheibert.
Hi, welcome everyone. Thank you very much. I appreciate all of you being here today. I'm Lourdes Scheibert and from Kokua Council. And my question is, if COVID continues to be a problem, considering that this year's pandemic resulted in the Capitol being closed, no public hearings, and the legislative session coming to a close, what can we do to carry on and ensure the public's voice is heard in 2021? Thank you.
Well, you can wear your mask, you can wash your hands, and you can practice safe social distancing. And all kidding aside, the only way we get back to anywhere close to the new normal is to continue to get the numbers to go down. And that will allow us to reopen. Right before we closed, we took out half of the chairs in the Senate conference rooms. We bought television monitors and stands so we could put televisions outside of the conference room so people who were coming to the hearings didn't all have to sit in the room. We had a process where you signed up, you got on the list so that, you know, we could maintain the amount of people that would be in the room. As I mentioned at the top of my remarks, we've now upgraded our IT and our bandwidth, so we think that we will be able to do remote testimony and be much more accessible than what we did to finish that last two sessions where we came in when the Capitol is closed. And as I look at the numbers on Oahu, it's my hope that we reopen in a safe way, this continues so that we would be reopened. But I would tell you in the new normal, you know, you probably need to get temperature screened when you walk into the Capitol. And while not foolproof, it at least provides a layer of safety. We have put plexiglass in certain desks that are the first point of entry. We are in the process of securing hand sanitizing stations that will be in each office so that employees, members, and the public can all continue to practice or do best practices for healthcare. But it's really all of us taking personal responsibility to get the number down, to allow us to get back to a situation that is more reminiscent of life before COVID-19.
Okay, we have another question from Joanne Kealoha.
Sorry. Good morning. Thank you all for joining us today. My name is Joanne Kealoha. I'm with the Hawaii Alliance for Retired Americans, representing the ILWU. Piggybacking onto a question that Al had asked earlier about the budget shortfall. I know that there's a huge amount of money that you need to find or need to make cuts in or whatever. And I think that sometimes the legislators may be tempted to consider cuts to retiree health benefits, which are very, very, very good benefits for the retirees. And also maybe even consider taxing income, the retiree income. So I'm wondering if you can give us some kind of commitment that you will not step into that kind of a draconian possibility. Is there any way that you could make a commitment?
No, there isn't, because I'm 1 out of 25 votes. But as you know, back in 2011, the Senate was firm in not taxing pensions in the solution we had to the Great Recession. You know, as I mentioned, we did eliminate 43 general excise tax exemptions. We did make other cuts to the budget to get there without taxing pensions. And we understand with the high cost of living and the fixed income, the impact on the seniors. So that's not the most optimum way we would get there. For other retirement benefits, especially if you're a government worker, then there's nothing we can do constitutionally to impair anybody's retirement once they've exercised that retirement. It would have to be prescriptive fixes or legislation on what kind of retirement benefits would be paid to future employees when they would retire. So in that regard, you know, any government employee who's already retired, other than that taxing of pensions, we can't impair their medical benefit or other benefits that they already secured.
Thank you. Representative Nakashima, do you want to add anything to that?
No, I think Senate President covered it pretty well.
All right,
Thank you.
thank you very much. We went out of order a little bit, so we're going to go to Barbara Service regarding the top issues of 2020's legislative session. Barbara?
Good morning. Thank you for joining us, senators and representatives and others. The Hawaii Senior Advocates in 2020 had a pretty robust package. This would include PABIA, which is the Policy Advisory Board for Elder Affairs, Kokua Council, HARA, AARP, etc. These things included additional funding for augmenting the long-term care ombudsman program, clarifying a consistent victim age for crimes against seniors, making sure that seniors are given sufficient notice before cancellation of long-term care insurance, providing training on dementia to first responders, lowering the cost of prescription drugs, making changes to advanced care directives, Hawaii Saves, making it easier for small business employees to save, Hawaii Promise to make higher education, more affordable, assessment of the Long-Term Care Commission and others. This is put together pretty much in the Kupuna caucus package. None of these appropriation bills passed due to COVID, et cetera, aborted legislative session. Funds were also sought for the core Kupuna programs such as Kupuna Care, Aging and Disability Resource Center, Healthy Aging programs, and the Kupuna Caregiver program. I've since learned that the ADRC, the Aging and Disability Resource Centers, are funded through EOA, Executive Office on Aging, and I'm sure they got funding. Kupuna Care got the usual, give or take, 4.8 million, but the supplement was not approved because, it wasn't approved. Healthy Aging Partnerships, which is the only evidence-based program that the seniors have, and Kupuna Caregivers, which is to help working caregivers, are not funded in the second year of the biennium. We know that COVID-19 has taken center stage, but we need to know what we can do to make sure that these programs, excuse me, get funding, because we're talking, as Senator Kouchi said, this is our most vulnerable population, and we need to do everything we can to plan for them. Thank you.
Thank you very much, Barbara. Our next segment is regarding the Kupuna Caucus, Legislative Kupuna Caucus report. May I ask Representative Gregg Takayama, then Senator SHARON MORIWAKI to give their reports to us? Representative Takayama.
Hello, everyone. Thank you for having me and Senator MORIWAKI this morning to talk about the Kupuna Caucus and our issues past and present and going forward. First of all, going back to the 2020 session, which seems like forever ago that we started in January. Correct me if I'm wrong, but I believe that Kupuna Care was actually funded at the $9 million level for this current year. We funded it for 2 fiscal years last year. So funding was assured for both years in the budget. While the session was in session and was considering the Kupuna Caregivers program, you probably recall our businesses collapsed. And so we were informed by the State Office on Aging that the need for, or the requests from caregivers for help really disappeared to a large extent because they were unemployed, they were able to care for their loved ones. So we withdrew the $1.5 million request for Kupuna Caregivers. As far as healthy aging, you might recall that with all the restrictions on COVID, the ability to meet for exercise or other kinds of classes for seniors was not available. I mean, they simply could not meet. So we also withdrew the $500,000 request for healthy aging. Going forward to the 2021 session, again, we will seek, I believe, funds for our Kupuna Caucus, Kupuna Care, Kupuna Caregivers, and Healthy Aging programs. But I have to caution that, as you've heard from our House and Senate leadership, that the financial picture will make it very difficult. And as you heard from Senate President, we're facing a $1.4 billion deficit, and this is in a state budget that's about $8 billion total every year. So we face a huge challenge in funding all of the programs that we have before. Because of the uncertainty of the Kupuna Caregiver program, and I'll certainly defer to committee chairs like Senator Baker, but it might be time for us to consider combining the Kupuna Care and the Kupuna Caregiver program together as one, because everyone who's eligible for the Kupuna Caregiver program is also eligible for Kupuna Care. So it might be that we consider combining them and giving priority for Kupuna Care to those recipients who have working family caregivers. Just a thought. But again, as we face financial difficulties next year and who knows for how long, it's time to remind everyone that Kupuna Care is not a special interest program. It actually serves everyone's interest because it saves money. The more people we are able, the more frail elderly we are able to keep living independently at home, the less funds we spend via Medicaid to put them in nursing homes where they really don't want to be in the first place. And so that's something that I think we all need to remind our legislators in the coming year. Finally, I just wanted to mention that the Kupuna Caucus surveyed all of our stakeholders a couple months ago and received responses from about 24 of our stakeholders, community groups, and other service organizations. And what came through is the fact that social distancing affects everyone, but it really affects our seniors. Senate President's mother will be going into a nursing facility. She'll lose contact, physical contact with him and the rest of her family, as thousands of other seniors in such situations. So what's becoming all the more clear is the need for technology to reach our seniors, whether they're in facilities or whether they're living homebound. The need not just for telephone service, but for Wi-Fi and devices that enable seniors to see, not touch, but at least see and communicate with their loved ones has become all the more important. And I'm open to suggestions, and we can probably discuss this in Kupuna Caucus as to how we actually achieve that, how we reach isolated seniors. But I think that's certainly become one of the important issues that we will need to confront in the next few months. So with that, I'm happy to turn it over to Senator MORIWAKI.
Thank you. Senator MORIWAKI?
Aloha. Thank you, Hara, and thank you, Kokua Council, for this opportunity to engage before the session starts next year. As everybody else has stated, it's been a rough year. The close down of the Capitol. We've been so successful in the past with the Kokua Council. And this year it was 0 for 10, I think, or 11 that we had going forward. And next year looks, as you heard from Senate and House leadership, that it's going to be difficult. We have a $1.4 billion shortfall, and it's probably going into the next 4 years. So that we have to really think more creatively. I think what I sit on, as Senator President said, on the COVID committee, and what I've seen is that it exposes a lot of the shortfalls in government, shortfalls in how we communicate with those we serve, and the need for us to look at whether it's technology or different ways of serving the public, or consolidating services that are, and eliminating services that aren't really reaching the most vulnerable. And I think it's also exposed the vulnerabilities of populations that were unseen, unheard, and now we're seeing them front and center with the nursing homes and the outbreaks in nursing homes that should have been inspected, should have been much more hygienic and caring for these seniors. So I think that's a really major area we might want to talk about at Kokua Caucus, Kupuna Caucus, because I think that's where I want to thank the community working group that actually it was focused on PPEs and how we get that to the seniors and the people who work with them. But it has uncovered the lack of real standards and ways of operating and monitoring and consulting and supplying those 1,700 adult care homes and family care homes that really aren't even on the radar. We're looking at the nursing homes that were being affected, but we haven't even tested those in these smaller homes where they probably don't have that kind of support. So I want to thank the committee that really pursued that because it's not just the PPEs, it really is the standards of operating and what do you do when a visitor comes in? How do you check that? How do you have, as Rep. Takayama said, how do you use remote as much as possible so that you can keep the seniors safe and not have the kind of outbreaks that we've seen, unfortunately, in the nursing homes. We haven't even started to test all the other homes and think of the testing is the detection. So in the COVID committee, we really looked at working with, and I want to put to ease that we are not fighting the administration. We are trying to work together and as much as possible, collaborate on how best we can serve the people that we're hearing from a lot. On testing, on contact tracing, on containing, and on treating our most vulnerable in our community. And I think it's really important, and I really appreciate the work of that working group. And hopefully we can look at how, maybe not in terms of funding, but in terms of reorganizing and looking at how the policies and procedures can be changed for example, the Office of Healthcare Assurance can be looking at maybe collaborating with a long-term care ombudsman program. The long-term ombudsman has been so underfunded, and yet they really, their group of volunteers mostly are the eyes and ears of really the people who are in these homes and really have no voice other than the ombudsman. So if the ombudsman were to coordinate with OCA, and find policies and use them as outreach, it could save resources, but also expand coverage. And those are the kinds of things I think in the new normal, we really need to start addressing. And some of the bills that did not pass the last time, I hope we can get the funding as Rep. Takayama says on kupuna care, and maybe coordinating that and adding to that to also include kupuna caregivers, but also looking at the long-term care ombudsman. I think that is a real resource in our community that's been really underutilized. I mean, they've been overworked, but we have not used them as we really should, and coordinate that with the Office of Healthcare Assurance and also with MedQuest. So that's one area. Again, I think our focus in the next year should be surely on prevention, but also on vulnerable, because they really don't have a voice other than all of you. And I think their voices need to be heard. They need to have the services that really, if there are lack of resources, should be placed to protect them from even more vulnerability. The other kinds of policies, so it's not really costing us money, are the two bills that I looked at last year, which were the elder abuse, financial abuse, and assault bill, which was to increase the penalties. That might not go over well with some of my colleagues, but I think it's a deterrent. How do you prevent those people already shuttered in when they go out, or when now that we're doing remote, that they can get their savings taken out from them remotely? We might want to look at that as well, as how do we protect and safeguard our vulnerable. And the other is an easy fix. I think it was almost going to pass before COVID came down on us, was the insurance, the notice that you can't really terminate a policy without giving good notice to the insured that you're going to terminate. That has left a lot of people without long-term care insurance when they felt they were paying for it and they missed a payment and they didn't even know, and all of a sudden they have no services. So I think those are easy kinds of bills, maybe that are policy bills, so they don't cost money, but they certainly do protect the vulnerable in our community. So I'll leave you with that, but I think going forward, I'd like us to maybe really talk about how do we serve the vulnerable in these 8,000 in 1,700 arches and family care homes. You know, those are the unsung people who I think we really need to be helping, because the nursing homes are like hospitals. They're large institutions. They are really monitored, but these smaller ones where they don't have the resources and they don't know, maybe more education, outreach, and things that we could do maybe with administration to work more collaboratively. So I'll leave you with that and be glad to answer any questions.
Thank you, Senator. Representative Takayama and Senator Moriwaki, we have questions for you from Helen Wagner and Rick Tabor. Helen, will you please start?
Okay, I'm Helen Wagner, and I serve on the Kokua board as vice president and also on HARA as one of the directors. My question, with the outcome of recent Kupuna needs survey last year that was prioritized Kupuna issues, and because of the COVID virus, what issues do you think we should carry on for 2021 since none of them passed?
Well, I'll be happy to take a stab at it.
Okay.
I think both Senator Moriwaki and I discussed some of the issues going forward that would better protect our isolated seniors as well as those who are in facilities safety-wise from COVID, as well as the flu. So I think we need to look at that total sphere of issues relating to elder safety, which honestly we haven't discussed as a Kupuna caucus in years prior because it hadn't reached such a pandemic stage as we have now. And certainly the only other thing I would add as well is the communication/technology issue of reaching isolated seniors and enabling them to be part of the larger community, at least virtually, would be my suggestions.
I would just echo that. I think that it's really important to communicate. I have a lot of seniors in my district, and they call, they do know how to email. They can't do very much more than that. But training, I think the healthy aging program, which was an exercise, you can do that online, but it's really hard for seniors. I think, for example, the Waikiki Community Center is teaching seniors how to get online, but I can't. I have problems with even connecting to Zoom. So so I think part of it is the training. Part of it is how do we reach out to the vulnerable, but also the healthy, and it might be through these kinds of seminars, through having, and it's cheaper. I mean, doing social media is free. Ways in which you can connect up with the seniors if they don't have a screen, any kind of phone or any kind of device. I think maybe looking at how we might help community centers do something with that and see what kind of resources are needed there. But there really needs to have the communication and the connection is so important when they're shuttered in. And these are healthy seniors becoming unhealthy because they're shuttered in and they're afraid to go out. So maybe some of that can be a discussion of what and how we can do that. But I echo everything that Representative Takayama said.
Thank you.
Thank you very much. Rick Tabor, your question, please.
Okay. Hi, everybody. I really appreciate you joining us. And so far, I've learned a lot. So some of our questions may overlap a little bit of what you've talked about already. You're probably aware I'm the first vice president of Kokua Council. Helen is actually second vice president, and Lila is the president. So I'm also involved in some other things. So at the beginning of September, I joined the Meals on Wheels America, a virtual national conference, and it was Zoomed. It was really remarkable. So over 2,000 people participated in that, and it was just great. And then in June, our Rotary, so you know that our Rotary was going to do Rotary International here, and we had all kinds of people coming. It was going to be a huge thing for the island. We put a lot of work into it. Well, then COVID, right? So they ended up doing an international conference, which was remarkable. So 60,000 people registered for that. 175,000 viewers were on that. And us as the Kokua Council, we learned, as Lila pointed out, to do Zoom very early on, and we've been very active and we stayed connected, which has really helped as far as not just us not feeling isolated, but also us being able to try to work on the solutions for this huge issue that we're facing that's really going to be around for a while. So my question is, with all of that, what's the legislators, what are you guys thinking about as far as being able to connect to the public? We've kind of asked that before, but how to reconnect. I personally, I do miss the Legislative Kupuna Caucus that you guys have led. Those were always very informative. So when do we get back to that? I heard you mention, you know, when we meet as the Kupuna Caucus, but when is that and how are we going to do that? And how can we actually, again, do public, you know, testimony, you know, with people on that could actually see and communicate and talk together. It's one thing to write stuff, but it's another thing to get involved. I'll go one step further. This week I actually was hired, Percy hired me to help out with Generation Magazine, and we're going to bring back the radio show. We're hoping to bring back the TV show as soon as it's safe. So we're doing all of that. What can we expect from you guys at the state level? Thank you.
I'll jump in because we do have the capability of doing Zoom, and my staff, not me, is much better at hosting it. So we were already talking about that in terms of getting Kupuna Caucus back on, and I'm sure Greg, you're open to that. That maybe the first week in November, our usual Friday 2 p.m. Could be a real possibility, and we can do the Zoom hosting for the Kupuna Caucus. I think it's really the legislature as well. Our COVID committees are all on Zoom and Alelo, so there's that opportunity, and we get interactive on Zoom. So that is a way I think the legislature will be operating until we find that we get out of tier 1, you know, and get into tier 2 or tier 3. It's going to have to be that way, as safer. But you can come down to the Capitol, as President said. You know, you get thermal checked and so forth. But I think for the vulnerable, I would strongly urge not really coming into close contact with a lot of people. So it's safer if we can find a way that they can go somewhere close to then testify by Zoom, for example. But Representative Takayama, I turn it to you for other.
Yeah, I would certainly second what Senator MORIWAKI suggested in terms of resuming our Kupuna Caucus meetings by Zoom. For myself, you know, I am one of those legislators who actually have a general election race on November 3rd. Oh. And if I have the good fortune of being re-elected by the people of Pro City, I would be happy to participate shortly thereafter. But certainly, yeah, we do actually miss seeing all of you at the Kupuna Caucus, yes, and look forward to resuming our meetings.
Thank you.
Thank you very much. That was a interesting pun there. Next, we're going to have the assessment of the 2020 legislative session. And this would, we asked Senator Baker, Representative Kobayashi. I don't know if Representative Takumi has joined us yet. Representative Ward, Representative Thielen, Senator Favela to participate. May we start with Senator Baker for your assessment, please?
Well, thank you. Thank you for giving us the opportunity to connect this way. If we were going to have a pandemic, it's lucky that we have all of the technology that we do to stay engaged and stay informed. Before I get started on the assessment of the 2020 legislature, I just want to give a shout out to my colleague who will not be coming back to the legislature. He decided to retire, Senator Russell Ruderman. And of course, he chaired the Senate Committee on Human Services. And we had a lot of joint hearings and a lot of joint activities because some had health, some had consumer protection, some of them were human services and overlapped. So just wanted to recognize him for all of his work, and we'll be looking for a new colleague to take that particular chair when we reconvene. We didn't pass a lot of legislation that affects seniors. Part of it was because we just couldn't pass anything that had money in it. So we were not able to do as much as many of us wanted to. And when we had our session interrupted and had to come back later, of course, we were limited in what could continue to go forward. So the couple of things that passed had to do with updating our notary laws. And many of us need to get items notarized, so it should be a little bit easier now with now that Act 54 is in place. Many of us use massage both as a good therapy as well as just a way to make us feel better. And so Act 64 made sure that all of the massage therapy establishments had to adhere to good standards of sanitation and best practices. For some reason, the law that affected them had been allowed to lapse. So we put it back on the books. Another one that may affect a number of people had to do with authorizing a pharmacy to provide a customized patient medication package, so that if you have a valid prescription and it has all the labeling and dispensing requirements, when it's given to you, it allows you to combine so you don't have to piecemeal your prescriptions. And I think we even allowed some Schedule I substances to be included in that. So it makes it easier for seniors particularly to access. That was one of Representative Mizuno's, he sponsored that legislation. That became Act 27. We also helped our Human Services Department by repealing the spending ceiling on the monies in the Civil Monetary Penalty Special Fund that is being used by Medicare and Medicaid services. And we also expanded the opportunities for our young people to go into the field of mental health counseling. That was part of the governor's package, and I really think it's going to open up opportunities for our young people to go into an area that is underserviced and is very, very important. So I was delighted to see that those measures passed. Unfortunately, almost anything that had financial impacts that was coming out of the general fund didn't pass, and we'll be looking at some of those again. This is the beginning of a new biennium, so everything has to be reintroduced. And I know that Rep. Takumi and I will be looking at some of these items for reintroduction to see that, make sure that we continue the dialogue going forward. So that's kind of a brief report. If any of you have any questions, I'll be happy to try to answer them.
Thank you very much. Representative Kobayashi. So Senator Baker, if you'll remain, will be questions.
Can you hear me?
Yes.
In terms of the 2020 session, I think that that's more or less hindsight. I'd like to focus on the word assessment. I think that we need to assess what we're going to be doing from here on out. And we need to prioritize because, of course, we're going to be cutting money in huge amounts. First, we take the low-hanging fruit, the low-hanging branches the first year, and then higher hanging branches the next year, the next year, and the next year. At least for 4 years, we're going to be looking at $1 billion each year to cut. And each year, the cutting will be more horrendous and, shall we say, more painful. I think we should assess what we're doing in terms of, number one, making full use of federal funds. Kapuna Care is a good program that keeps people who otherwise might be in nursing homes in their homes. I'd like to call attention to Nursing Home Without Walls. Last week, former state representative Connie Chun passed away, and in her obituary, she said that she was the co-author of Nursing Homes Without Walls. Well, I was the co-author with Connie. Nursing Home Without Walls was, no longer is, was a Medicaid waiver program. And of course, this means that half the funds are federal funds. And it allowed people who were qualified to be in nursing homes to stay in their homes and then get services delivered to their homes. Everything from an RN, maybe once or twice a month, a personal caregiver, perhaps several hours to 8 hours per day, a nutritionist once a month, physical therapist once or twice a week, perhaps, et cetera, et cetera. That kind of help from the feds might also be part of what we look at in terms of SNAP, supplemental nutrition, otherwise known as food stamps. A full-on effort to get as many people onto the food stamp program might help a lot of people, as well as stretch our dollars. The other thing that we might look at is taking full use of volunteers and the nonprofit sector. Meals on Wheels might fit into that category. And so would many of the public health centers, that is, the federally qualified public health centers, be they
QHCs.
THC, Kokua, Kali Valley, Waikiki Health Center, except
Waianae Coast.
Waianae Coast, Bay Clinic on Big Island, etc. So if we can direct seniors, alert seniors that they might be able to get services from federally qualified health centers, from Meals and Wheels, that might again stretch our dollars. I think heavy prioritization has to be done. Normally, we would, at the legislature, we would prioritize safety and health issues. So an additional position or two for long-term care ombudsman might fit into the category of safety and health. Certainly, as Senator Moriwaki had said before, there are a lot of small groups, homes, that might need extra help or maybe a little push, if you know what I mean, to be safer. And I think that we're going to be looking at a real difficult year, followed by at least 3 more difficult years. So those are comments about assessment.
Thank you very much, Representative Kobayashi. I don't see Representative Takumi on the screen. So may I ask that we proceed with Representative Ward?
Hello, hi, everybody. Good morning. Thank you for the invitation. Senator Baker started out with a shout out to Senator Ruderman. I want to do a shout out and a yield right away for her to go ahead of me if Representative Phelan is still on and would like to proceed as a way of honoring her in her retirement and her expertise in this particular area. Representative Phelan. If you will, otherwise I shall proceed.
Alt plus,
Okay.
plus, unmuted me. Okay, am I unmuted?
Yes, you are.
Wonderful. We had to get the tech group up here because for some reason my iPad at the Capitol would not hook up back into you all. I lost you. I have a couple of things I would like to say. There's going to be such a demand for the few resources that we're going to be able to provide at the Capitol. And the thing that's going to be very important is that the members of Kokua Council and HARA are out there at the forefront speaking and explaining what are the needs of the seniors that they're representing. Your voice is going to be more important this coming session than any.
Representative Phelan, you're muted for some reason. You're muted?
Yeah, we can't hear you.
Oh. The Zoom program is rather sensitive. I think she probably inadvertently hit a button or something.
It actually went out on her even with it unmuted, but now it's muted and not coming back up.
You went off the grid, so to speak? Oh. That means she's got to go out and get back in.
Yes, it tried to reconnect.
It's reconnecting. Welcome to Zoom.
Representative Ward, maybe you could proceed as we wait for Representative to reconnect.
Excellent idea. And at a drop of a hat, I can yield back and then just be on standby. First of all, thank you for the invitation to join this August group. And anybody who honors my three friends, Breen Harimoto, John Radcliffe, and the Project Dana, my East West Center project leader, Rose Nakamura. I'm glad to speak with them as the first honored in this particular meeting. Otherwise, the good, bad, and the ugly, I like the title. I like every year you guys go for it. This year it's been difficult because as we try to talk about 2021, even though Roz Baker did an excellent job of summarizing it, we really kind of wandered into well, instead of 2020, we went into 2021. And I think what Roz has said about 2021 is probably sufficient, because if we look at the whole, or holistically, 2021, the good, bad, and the ugly, the good is going to be we're really aware of the Kupuna needs. We're really aware of some of the things that we were kind of blinded for earlier. The bad is that the COVID is now the new normal for all the things that we look at and understand. And then the ugly is, and Gregg did a good job, and everybody's mentioned, hey, we got a budget, a big hole in our budget. I've been hearing 1.3 million, because I've been hearing 2.3 million even more, because look, we got an 8 billion per year, $23 million a day we need to keep the lights on at the government. 75% of all of government money comes from 50% GT, 25% from withholding. Well, we've got over 100,000 people still not employed. So when when Bertrand and all the other ones said, hey, you know, it's going to be a tight one, it's really true. It's going to be fiscally really, 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 really tight. Having said that, that doesn't mean that there's going to be cutting and slashing and burning the way we did, what, 10 years ago? So we've been here and done that. We know there were furloughs, there were cuts, but we got through it. So I am optimistic that we're going to get through this thing, and we've actually got a learning curve. I want to talk about the good things that happened, even though it started out very bad. When New York City had with a crisis in one of its centers, the mayor actually turned around and put those in a nursing home with the COVID. And not to point out what New York did, but what we didn't do, we didn't wake up until Halinani had a COVID outbreak. We should have been testing these homes, and as I think was brought out earlier by the Senator MORIWAKI, and we haven't even got to the care homes yet. So we didn't really respond quick enough for the Halinani outbreak. And then what happened? OCCC had an outbreak. So the point is we're a little bit slow in the testing. And then even after OCCC, we had the Hilo Vet Center, which I think is still probably bubbling up. I didn't hear Mark Nakashima say anything different. That has been a little bit of a wake-up call, to say the least. Testing, testing, and testing is the way we're going to find out where this stuff is, and the tracing is how we're going to do it. And I want to put a shout out for Hawaii's own Oceanate Spit in a Cup. You guys that were on the Senate Special Committee heard his presentation. It's like a self-administered pregnancy test. In 10 minutes, you know whether you got it or you don't, and it's $20. And if it gets even highly volume in production, locally that is, it can go down to $5. So we should be able to take control with bubbles in the DOE, but Representative McDermott and I wrote Making Hawaii Safe for Travel. We should have COVID-free flights to Hawaii, COVID-free hotels. Workers should not be threatened by visitors coming, and we should have COVID-free workplaces, and that's all of us. But in the meantime, we're going to have to cope with it. We've got masking, we've got distances, and thank God we've got Zoom, even though unfortunately it is not allowed my colleague Representative Thielen to feed. Two other crises are coming on board I wanted to mention, not as a scare tactic, but so we're not surprised. There is going to be a bit of an uptick in the COVID rate. Lieutenant Governor Green has said 1 out of 1,000 visitors likely will bring in COVID. Some have said, oh no, that's too low, it's going to be higher. Whatever it is, we're going to expect an uptick, and we shouldn't be overly shocked by it. We should be prepared by it because we got all of these procedures and protocols in place with the mayors and with the state legislature. The second thing is, it's because of the correlation between joblessness and homelessness. If on the 15th we open up and we sputter, we're going to have so many people who are not paying their rent right now to get evicted at the end of the year unless that moratorium is extended, because the high probability of joblessness and homelessness. I think Columbia University did a study, like they expected an uptick of like 40% in the homeless. I don't say that because it's going to compete with money for the kupuna, but because it's going to be one of those variables. When you've got a shortage, you really have to go back to what Representative Marcus Ashua say, what are the essential services? What are the must-fund areas? And I would say you guys, the kupuna, are one of those must-fund areas. I don't say that in a political sense, but I say in what you've got statistically. 65 and over are 16% of the population, but you are 80% of the deaths that have taken place in this pandemic. You've paid 5 times your share. Having said that, and I know earlier it was a commitment, hey, would you promise not, I forget who said it, would you promise not to cut any programs for the kupuna? I'm prepared to say that. I'm prepared to say that you guys are kind of like the first responders to the COVID survival because you've been hit highest. And with that, I think your ongoing awareness by the legislatures should be taken into consideration. Now, I'm going to say something a little bit self-aggrandizing. In the Health Committee, when we were talking about this in the early March, I had with Representative Senator Ventura an amendment to a bill that said we are now going to inspect the nursing homes and the care homes. Unfortunately, within a matter of days, the plug was pulled at the legislature. But if that would have gone in the legislature, we still have a chance to do it later on, that would have saved, I would think, some lives in Hilo and what happened at the Bethel Center. My point is, you should be prioritized, your budget should not be cut. And let me end with one note of hope. We are going to get through this. This COVID is going to be thrown on the ash heap of history. We have been there, done that in ways that we've conquered almost every other thing that has come against us. We're Americans, we're creative, we're innovative. We can do this. And right now we've got one of the solutions right down the street with Oceanit and Patrick Sullivan. Those are some of my few remarks, and I would yield back to Representative Thielen. Did she happen to get back on?
I don't see her. I've been watching and I don't see her. I think we need to just proceed. Thank you, Representative Ward.
Okay, thank you.
Thank you. Senator Favela, your assessment of the 2020 session, please.
First of all, it's an honor and pleasure to serve on the special committee. I was privileged to be one of the senators chosen to be part of this committee. Being new to the legislative process, I was just kind of shocked and I guess you can say shocked and awe on how each of the departments that came before us in the beginning, and it wasn't like anybody was on the hot seat on how they had received it. We don't know why they felt that way. We were just asking pressing questions that we was asked by the community and the people that we represent of my community of Ever Beach and the state of Hawaii. So when going forward and the different departments came and we realized that for some reason we wasn't getting the information as soon as we should have done. Then we later on found out that the chief of staff was telling the directors from the departments to send it to her. She's going to look it through, and then she's going to send it to Chair De La Cruz. Well, that slowed the process down, and we realized we wasn't getting anything. So we started sending more emails and more letters to the department. After 4 consecutive times, after 3 grueling meetings with chief of staff, we finally came to a conclusion that we needed to go, and when we go into special session, we was going to give the committee subpoena powers. That didn't go along good with the governor at the time, so we had a meeting upstairs, and the governor asked us to rescind that, and he was going to have the attorney general kind of piggyback with the directors coming to the meeting. But that went okay for a while. But I just want to stay on the record so you guys understand with the prison. Out of all the directors that came before us, yeah, Nolan Espenda is the only committee director that came to the committee that had everything in order. For whatever reason, he didn't have the funding, he didn't have the cooperation of whoever was supposed to help him with certain things. Even with the outbreak that happened with one inmate, with the sheriff bringing an inmate and the sheriff getting tested positive with the virus, the Department of Health, of course, you know, fell short in going out there and responding. You know, not until we started dialoguing, realizing that, hey, something is wrong. The Department of for unemployment, things are not happening. So we look more into it and more into it. Then we find out that the program and the server is old and outdated. So when everybody went in to try to put in their unemployment, it crashed. So everybody went on and blamed the director and blah, blah, blah. Long story short, he ended up resigning, whatever. But to me, to chastise guys like Nolan, you know, and Department of the Unemployment, Scott, yeah, Scott, I think it's Scott. Sorry, the airplane is flying overhead. We set them up to fail. Nobody knew the pandemic was coming. We didn't even expect the pandemic. But we as legislators should have equipped each department, upgrade each department, so for the community. We should have been more proactive than reactive. But then again, this is never happened on Scott's watch or Nolan's watch. These things was happening over years of not giving funding, correct funding, and keeping these places and different departments updated. So that's what happened with that. Then with we was wondering how come the contact tracings wasn't being affected, and we questioned that. And then of course, you know how the story goes that we, not me, I had a community event, but our committee went there. We was invited the day before, and we showed up, and we found out that that wasn't true. But I said, and I talked to the governor on the phone, and I told the governor, please understand this. When we was all, I guess we was all inside the committee room. Don't take it as we're trying to be against you and the directors. We're not trying to be like dictators. Yeah, we try to be communicators. So I said, don't think of it as a fist. Yeah, think it is as a helping hand, because we all work for the state. We all work for the people of Hawaii. So I just wanted him to understand, and all the directors to understand, that the committee wasn't formed to chastise the governor or chastise the directors. We just needed answers to the community because they were asking. And Senate President and Chair De La Cruz is doing a great job. And like I said, I was very honored to be a part of it. But to me, going forward, learning all of this, and we're all talking about reopening and safe reopening. The hotel industry have a safe reopening plan. And I'm gonna ask Chair De La Cruz to see if we can have them come, all the different departments of the tourist industry in front of the committee to let us know how they're doing on the reopening plan. The problem is, long time ago, we depended on agriculture to push our economic in Hawaii. So now it's reversed. Before, agriculture used to bring the tourists in and drove our economic force. But now we slowly have to bring back and realize now for agriculture to work, and to agriculture to double, and to diversify our economy with all kinds of different programs, we need to slowly, including the Kapuna caucus and all the things for our seniors who really needs these programs, knowing that I have my dad who's 81 years old, God bless him, that I get to live with him in his home and be with him when I need to. But the bottom line is, if we do not slowly, safely open and be smart about how we're going to bring up the agriculture right now. We've been talking about it before I got to the Senate, how we was going to start doubling the food production, right? The neighbor island where Senator Kouchi is, they're doing a great job in food to table. But to do something here, we don't have the funding. And the funding coming to tourism. I know a lot of people is afraid of the tourists are coming in. Yes, we need to do at least a minimum of 2 testing. We went to clinical labs. Let me tell you, we went to the State Clinical and Diagnostic Laboratory. These guys have a job on their hands. My hat's off to all of them that work in there, because I was just scared to even walk in there. But they told us it was safe, so we went in. But we have the capabilities of doubling or tripling our testing, and we have great people that is doing it. We just need to have a system that is going to be good for all, not just for the tourists, but for our teachers, our custodians, our schools, our first responders, prison guard. The prison and adult correction officers. All of them need to have a constant testing, and like Representative Jean Ward said, the one testing that they came before us, we love it. But right now, we had, I know we had requested, and I know we had talked to the governor about, I think it was about $10 million that needed for this to go forward. I understand that the Food and Drug Administration never approved it yet, but it's coming. The process takes time. But if we don't jump on top of this and this being taken to some food, pharmaceutical company in the mainland and jumped on something like this that would be benefiting Hawaii in the, again, generating income for our island. So those are the things that we need to do. What I had learned during this legislative session that we need to do slowly. Everything should be slowly. But with the CARE Act money, we should get these labs up and running. We should be able to make our own warehouses and make our own products here. That would generate jobs, put more money into medical and education and high tech, because you can spend some of that money there. We need to be more creative. You know, I'm not so sure about giving the card to everyone, because we might have some, you know, person go to you know, a very expensive steakhouse and spend $500 in one crack. So we need to be a little bit more creative, but it's something to do right now. Honestly, if I had a voice and if the governor would listen or even give me a time, this is what I would recommend. Every single small business we have accountability for every small businesses on our island, especially our local small businesses. We should be giving a CARE Act money to them. Because when they first reopened, they spent a lot of their money in making protection for us to come and sit down at their restaurant, and they read really good. And then boom, we close again. They had to lay off all their workers. They had to do all this changing again. So to me, if you really want to impact the economy, instead of giving everybody $500, look at the list of all the small businesses. We should have saved. We should have saved and try to find a way to save Licky Drive-In. 80+ years, a dynasty down the tubes. So those are the things I think the CARE Act, which we can use to generate money to our small businesses now. We bailed out the fishing industry. We did not bail out or even help out the beef industry. Our local beef farmers are hurting. We have over 200,000 pounds of grass-fed beef sitting down, idling. But no funding went to those industries to generate for the economy to strive. So we know over the years of being in Hawaii, our small business is the backbone of our state. And if we cannot keep them alive and afloat and give them some of that CARE Act money, we're going to slowly lose more small businesses. So these are the things that I observe as being on the committee. And I tell you, I work with a bunch of great senators, Senator MORIWAKI, Senator Jarrett, Senator Kadani, Senator Kim, Senator Donovan De La Cruz. It's been an awesome ride being on there. But let me tell you, those long 6 to 8 hour meetings, sometimes it's draining. But it's a blessing in disguise, because why? We're doing it for our families and our friends and our state of Hawaii that we love. And it's a great thing. So that's what I think we should do. Give somebody to the small businesses to help them survive on this pandemic time. Thank you for you guys' time.
Thank you, Senator. Senator Baker, Senator Favela, Representative Kobayashi, Representative Jean Ward. I don't know if Representative Thielen is on. I don't think she is, but will you please still stay with us? We have questions from Rick Tabor, H. Doug Matsuoka, Kathy Wyatt, Dale Head, and Jean Dobashi. Rick, can you please start with your question?
Sure. So you somewhat answered my question a little bit already, so I'm going to modify it just slightly. I will say I'm very relieved to hear that our kapuna, it doesn't sound like from you all that it's a low-hanging fruit. In fact, it's very high. It's very high and it's very vulnerable, so I'm very concerned. And I don't envy the job that you guys will have to do here in this next year in this unprecedented time. I was honored, you know, in the 2019 session that we all worked together and did a remarkable job for passing some things for our kapuna that was really amazing. And I was hopeful this year would be the same, but of course, you know what happened. So, and next year we move into a very, very interesting year indeed, and a biennium at that. So again, our kapuna population continued to increase at a record pace, with the need for more services clearly evident. Our current budget obviously will not cover all the eligible kapuna that need assistance from Kapuna Care Program and the other programs that we've already talked about here, that they so desperately need to age in place. And if they're not aging in place, they really decline pretty fast. And so it's really kind of a life-threatening situation, health-wise and everything else. Majority of people, I've never heard anybody so far in all my time working with Kupuna say that they didn't want to age in place. And aging in place is just so healthy for them, but so difficult for the families. So 65% of the care that families are offering to their families members, their Kupuna, takes them away from their jobs. They have to remortgage their houses. There's all kinds of stuff that goes on. So it's a very difficult situation. And sometimes they end up in a home just because the family is not able to do that. So with all of that in mind, what suggestions does this group have with what we can do to try to help them that we haven't already talked about, or even maybe elaborate on what we have talked about? How do we help these folks going forward in this situation? Thank you.
Well, that's really why we passed Kupuna Caregivers. And I'm disappointed that that seems to be one of the programs that is being slighted as a result of our monetary situation. So perhaps one of the things we can maybe put our heads together on is, are there some nonprofits, are there folks in the community who might be willing to step up to help make sure that this program goes forward? I think particularly now, we need creativity and we need to look at things in fresh ways and different ways. And I would love to join Senator Moriwaki and Senator Favela and others, our House colleagues, to see how we might be able to revitalize, restructure, or in some way make sure that that program goes forward, because I think it will definitely fulfill a need in our community.
Thank you.
Can I add a footnote to that? My fellow Rotarian, Rick, thank you for service above self.
Thank you.
We haven't met in
Rotarian
person.
too.
Oh, so sorry. Our fellow Rotarian from Maui. Oh, terrific. So we know what service above self is. And as you were speaking, I'm thinking, what can we do we haven't done? I would like to see universal testing for the elderly. Those at any time, anywhere that they want to get tested, they can get a free test. You don't have to go and say, well, I have symptoms. And a lot of the barriers are now, hey, you got to meet a certain threshold. And I think that's foolish, particularly as we get, I said earlier, Patrick Sullivan, the COVID, like a pregnancy test, things that can be quick and cheap, but it should be first accessible to those who are the priorities 65 and over. We have not paid attention, as I said earlier. We let Halinani, we let the OCCC, we let all of these outbreaks happen because we weren't paying attention to the group that's the oldest is the most vulnerable. So testing and contact tracing, I think, should go full force and without hesitation or without any income reservations. Thank you.
May I add a couple things? I spoke about Nursing Home Without Walls, a program that essentially allows for aging in place. And I should add, which was statutorily pegged at having to operate at 3/4 of the cost of a nursing home. The key to all of that was case management, and perhaps money should be put into case management. It is very difficult for a person who has never been involved in caring for a person to put together 5 or 6 or 7 or 8 different services and then have all of these people come to the home. And so that might be one suggestion, that monies either from Kupuna Care or somewhere else be used for case management.
Thank you.
You know, going forward, you know, like I said, like Senator Baker said, we'll be happy to work together and try to find find a solution going forward. But I know I had a bill going through to not tax our seniors 65 and over for medical and food and hygiene products for some of our seniors. I understand our senior population is getting greater and bigger, but we need to find something that, you know, right now we cannot, I know we cannot give any more money in certain areas, but I think we could be creative enough to try to lessen the cost on their wallet going to the store and buying medicine, because we all know the medicine cost is very expensive, and those things are hindering our seniors in either buying their food, medicine, or paying for their bills. So that was something that I was hoping that we can collaborate and getting going forward. And then another thing, because of this pandemic, and it's a worldwide pandemic, and because Hawaii is so unique in depending on tourism, I'm not sure how much of our federal delegates can come together and try to work and try to get some federal funding to for the shortfall for our kupuna and our seniors, vulnerable seniors going forward. So those are the things that I'd be happy to work with my colleagues in trying to obtain and get something going, even federally, to see what we can do for Hawaii, because Hawaii is different than any place else in the mainland or anywhere else in the world, because of we live in the middle of the Pacific, and our economy that was always driven highly on just tourism. Because of that, economic drive is not there. I think there's a way that we can talk to our delegates and our senators can get together with the governor and figuring out how we can get some kind of federal funding to offset the shortfall for our vulnerable seniors and our kupunas.
Can I just add one clarification? Prescription drugs in Hawaii are not subject to GET. There are some items that you get at a pharmacy that are taxable, but if it's a prescription drug, it's not taxable under the GET law.
Okay, thank you.
Madam Chair, may I have another bite at the apple also? Lila. Yeah, okay. What Senator Moriwaki told us is a bit of a wake-up call. I would like to see a letter that all of us legislators would sign to the Department of Health to go out and look at those care homes, because if they are out there bare naked right now, that is a clear and present danger. They are prolific. I mean, you want to talk about Kalihi and in the danger zones. I mean, it's like, whoa. Sharon, thank you for bringing that to our attention. Could our offices get together and get everybody's signature to write to the DOH to bring that as a clear and present thing that we should be having them pay attention to, proactively rather than reactively? Senator Moriwaki, are you there? She is on mute.
Unmute. Okay, I'd be glad to coordinate that if there's interest among all of you. Certainly we could ask the Department of Health what they're doing in terms of monitoring these 1,700 ARCs and family care homes. I don't know, Senator Baker, do you have any insight as to what's happening at DOH and the OH? I always keep on
OCA.
Yeah, OCA. Yeah.
Okay. I'm just getting ready to follow up with them. So they have a cycle. They have nurses that go out and do surveys with the nursing homes and with the family care homes. So I'll try to get an update on those activities and share it with everybody.
I think they don't do it across the board, and it's sort of like in a cycle. And during the pandemic,
there is a cycle because they don't have
staffing, right? Yeah.
Yeah.
But yeah, if you could put that on their radar, I'd be glad to pen something if others would like to. But let's. So Senator Baker, if you can let us know what you find out, that would be helpful.
Yes,
I will. Happy to.
Save some lives.
Yes. Yes. Thank you.
Thank you very much.
If we're done, Maya. Okay. I'm H. Doug Matsuoka. I'm on the board of Kokua Council. I also work for Hawaii Meals on Wheels, and to add to something that Representative Kobayashi said earlier, we had to actually furlough many of our volunteers because they're seniors, and we didn't want to put them in a dangerous place. And to make a point that Cullen Hayashida always reminds us that to think of seniors not as just consumer of services, but as contributors. And seniors are a huge demographic as far as the volunteers in anywhere, and I just want to point that out. I'm also a volunteer for Food Not Bombs, which provides food and other supplies for people on the street. I've noticed more and more homeless people, of course, because of the economics of the situation, but more disturbingly, more and more homeless seniors, elders on the street. So my question is a general one. You know, we all believe in aging in place. How do we keep our a place for aging for our seniors? What can we do to keep our kupuna under roof? Anybody want to take a shot at that?
Yeah, I'll take a shot at it. We have a huge Hawaii rental housing loan fund. Last I saw, we had about $200 million in that loan fund. This is for rental housing only, usually with some stipulation as to income eligibility. One thing that legislature could do is to either prioritize or ask this rental housing loan fund to do is set aside money for senior citizen projects. We have a few buildings, as you know, that are exclusively for seniors. But we have not, that is the legislature, has not specifically pushed that. Rather, we have let the agency and the developers prioritize within their own, shall we say, planning process.
Thank you.
Anyone else?
Does anyone else want to add to Doug's question?
Doug, I'll take a stab at it, because there should not be any elderly people who are homeless on the street. And I know that some of them are unable to help themselves, but I think government has been playing or not being serious with tough love, because people who can't help themselves, government has an obligation to help. And I'm not saying there should be any, if you're over 65, you automatically get a place, but you should not be elderly and homeless. And a lot of the people who are homeless, who are drugged and otherwise mentally deficient, should not be the one dictating what happens in public. There should be regulations by which we should be doing it. I know this is something the ACLU doesn't like to hear, but we're never going to get rid of the homelessness by giving always that it's okay, that you can be homeless, you can crap on the street, you can do anything, you can do whatever you want to build as long as we don't keep you there too long. Tough love is something where the homeless population is growing and growing and growing. And when you say that the elderly out there, I have not seen visibly the elderly as much as the other people. But there should be, where that is a provision, that anybody elderly should be able to get at one of these apartments that was
Yeah,
I'd
like to add to that. I don't think, I mean, it's a place to age is really the problem. I think some of the elderly that you might see who are homeless are actually the aged being homeless, you know, because I think that and I know now that the Department of Health has a whole, with Eddie Mercero, has a whole group together meeting on how do you get the homeless who don't want to go into shelter into mental health facilities or look at drug abuse, because those are the people who are staying out there when they can be in shelters and housing. And a lot of outreach is going to the homeless and people who you see still on the streets those who refuse to go into shelter. So I think if there is a need for housing, there are outreach workers among those going out to the homeless to try to get people into shelter. So if we know of those and what groups those are, then I think those are where we can start honing in and providing services, wraparound services or whatever is needed. But I know that in my community, there are a number of homeless, and I can call on one of the outreach agencies and they will try to get these people, and they know most of these people, get them into services they need. So again, it's honing in on who are they, what are their needs, and what can we do to get them into more healthy surroundings.
And if I may add one footnote, Hawaii Kai had such a serious outbreak, we formed a Hawaii Kai homeless task force to do that very outreach. But 95 to 99%, when we asked for either food, shelter, or other things that we could assist them with, thank you, but no thank you. In fact, they didn't even say thank you. They said, leave us alone, basically. This is really a social conundrum, if you will, almost a mutation to how we're going to get out of this. So it's difficult. It's not an easy silver bullet. But the kupuna, those who are elderly, should not be in that population. Thank you for the question, Doug. A tough one.
Thank you very much. All right.
You guys can hear.
Oh.
Yeah. You know, since we kind of talking a little bit about the homeless, the only way we're going to curb this homeless situation in our communities is that we need to stop them coming from the airport and different states. And they took away the walk and talk detail in mid-80s, maybe mid-90s at the airport because they said it was unconstitutional. But in this pandemic and this time that we're going forward, we need to tighten up our airport and making sure that we don't have an influx of other states' homeless coming to our state. Until we can control that, our homeless population will continue to grow and our economy going higher and higher. We still be having a lot of local families on the street. The kupunas that's on the street is because of, some of them is because of mental illness. A lot of them is mental illness, and we need to really work strongly with our mental illness and help people to go out there and really let them know, because exactly what Representative Jean Ward said, they're not going to like the help. But if they're not medically capable of making a decision, because you watch them and you can see, I don't want to describe some of the stuff that I see out there, you know that they're actually totally neglect, because just looking at them, no person or no senior should look and live like that on the street. So that's where the healthcare should come in and work with them on their social issues in trying to get them assessed with being mental health issues, because nobody can live on the street looking like that, things happening to them like that, if they're normal and they have a normal life and thinking like us, because that's not a normal, and nobody wants to live like that in the streets, in the gutters, and having that kind of problems. It has to, most of them nowadays, is not just drug problems, is because of mental illness. And a lot of us is not, when we look at them, we don't think of them that way because of how they look. But mental illness put a lot of our seniors on the street because of mental health, not because of drugs or not because they don't have a home. It's because of mental illness. And until we can change that mentality, we're not going to be able to help our homeless seniors back into a home and back into society where they belong.
All right. Thank you, Senator Favela. All right, Kathy, you're next. You have two questions, but I believe the first question has been answered. Can you go on to your second question, please?
Actually, they've both been partially answered, but I'm going to go ahead and say this. Dementia issues continue to be, to cause many to leave their full-time jobs to care for their kupuna. That reduces the state's tax revenue and adds to our unemployment rate. Now, the kupuna caregiver bill has always been difficult to get through. And Representative Takayama made an interesting comment earlier that if we combined the kupuna caregiver program with the kupuna care program, that it would work more efficiently. And I'm wondering if we would be able, do you think funding for, because the Kupuna Care program actually gets funding regularly, do you think that would help if we combine the program in that way? Would Kupuna Care be a part of that program? Does that make any sense?
I think everybody needs to understand that getting money for any of these programs is going to be very difficult this year because of the shortfall that we're looking at. So, you know, we can take a look and see, you know, if combining makes a difference and keeps both of them. But this is going to be a very, very, very tough year to get increases or even to get continued funding for some of our programs, I'm afraid, just because of the shortfall that we're looking at.
That is straight talk. And I want to add, we are now the least friendly business state, least friendly to business in the nation. We have got to become the most friendly because that's the lifeline for getting us the GT taxes. I would add with a question, if I may, Kathleen, what is the preponderance or the percentage of people that are elderly with dementia? How big of a problem is that? What are some numbers have you got in?
Wow, I don't have any figures on the top of my head, but it's huge.
So in Hawaii, we have 29,000 people that are currently diagnosed, but that we think it's actually a two times at least higher than that. Those are just people that have actually been diagnosed. It's a huge problem. It's growing rapidly as the population grows. So as people age, there's a higher percentage that are, and there's no treatment for it, and there's no cure for it. And so I'm with Alzheimer's Association, so is Kathy, so and Barbara as well.
Rick,
it's
are
a
you
huge
talking
issue.
5, 10, 15, 20%? What percentage was?
I'm not a mathematician, but if you take 29% of the population of Hawaii, what is that? It's a large percentage. Yeah.
Being 129,000 of the population, right?
Yeah.
Yeah.
So
Thank you.
We crunch the numbers.
But it's a lot. And I have adult daycare centers that take care of folks with dementia so that their families can work. And I hear, you know, heart-wrenching stories frequently from them because of what they're going through and having to cut back on hours and stuff. So it's a pretty important issue right now for us.
Thank you, Kathy. Does anyone else, any legislator want to add to Kathy's question? All right, if not, Dale Head, are you ready with yours? Oh, sure. First off, I'd like to thank the legislators for your commitment to public service. Mahalo. See, I myself am talking to you from Waianae today. About 3 decades down Pearl Harbor, where I was a blue-collar worker and elected union president for a while. Anyway, simple question. You covered a good part of this already. So some of Hawaii's food and supplemental rent COVID response funds will end when the year ends. What can the legislature do to ensure our island Kupuna receive nutritious meals and keep a roof over their heads? Thoughts? Thank you.
Good common sense question, Dale. It means spend wisely and spend it efficiently and expediently. Jill Takuda has got a follow the money chronology that she's doing. She would probably be the most expert, but my sense is Hawaii in its need for funds is probably not going to let not even $1 go without spending. Roz used to be on the WAM and Finance Committee. Would you agree with that? Do you think any money is going to get let out the back door?
No, I think we'll spend all the money that we have authorization to spend. But as I heard the question, the legislature's not in session. The legislature won't go back into session until January. So, and any monies that we would appropriate there wouldn't be spent until the beginning of the new fiscal year, which would be in October, I believe, October 1st. So we would be looking at any funds that have been authorized that are still available to be spent. But I would imagine that looking at whatever CARES Act money is available that still might be able to be spent. That has to be spent by the end of this year, this calendar year. I don't know that we're looking at any new money until the legislature would go back into session to see what else might be possible, but it's going to be a really tough session. Governor's having to look at cutting $1 billion out of the budget. That's huge. So we're going to have to try to make every dollar count and be as efficient. And that means that probably some of our nonprofits are not going to get funded to the level that they would want to be funded because we just don't have the money.
Rose, aren't you going to special session to do some appointments, or is that already put aside?
November. We have
those are. Session. Yeah, that's just the judicial appointments. Yeah.
Okay. A quick in and out.
Well, actually, we did those. No,
we have.
Yeah, we did those already. We did them yesterday.
And then we're going to come back one more time for a couple more November, but it's only the Senate. It's not the legislature.
Yeah, just the Senate, and they haven't. I think we have I think it's a Supreme Court nominee that we're coming back for, but they haven't set the time for that yet.
I think the CARES Act money has to be spent by the end of the year. Hopefully, that's what we're all hoping is that we'll have a new administration on the federal side that will get some relief and some collaboration between the House and the Senate and the administration. We've got to look to the federal because as everybody said, the state is really going to be in a bad place for 4 years. And a lot of it is looking at how can we collaborate with the private sector, public sector, nonprofits to really look at helping the vulnerable, especially in small businesses in our community.
The one thing I think we need to keep in the back of our minds, the Congress can deficit spend. The legislature cannot. Right. We have to have a balanced budget. We cannot spend more than what's in our account.
Good point. Very good point. We do a lot of juggling and we kind of balance the budget for a couple of days or hours, but yeah, in fact, the nation should be under that same requirement.
Mm-hmm.
If you'd like to look at your chat box, I looked up the figures for you, percentage-wise. So 1 in 10%, age 65 or older has Alzheimer's disease. A third of people 85 and older, or 32% have Alzheimer's. 5.8 million people have Alzheimer's disease nationwide. 80% age 75 or older have Alzheimer's. There's 29,000 in Hawaii.
That's a lot of people.
Mm-hmm.
Yeah, that's why we're so concerned.
All right, let's go on to our last question. Jean, are you ready? Jean Dobashi?
There. Can you hear me?
Yes, thank you.
Okay. Aloha, everyone, and it's now good afternoon. Thank you very much for sticking with us. I'm Jean Dobashi, a retired teacher from Kauai. I sit on the HARA board because I'm also on the National Alliance board as a CAN board member. And I am also the NEA president, national president of the NEA Retired. My question for you is, no one has a crystal ball, but what do you see as your personal #1 hot issue that you will tackle or even sponsor a bill in the upcoming session? So making this possibly as your closing remark, what is your own #1 hot issue for the upcoming session? And I believe there's 6 legislators left. Your one hot issue. And I know there's no money.
Okay, senators, you get the first bite at the apple.
Well, I'm going to be very honest. There have been so many things that have been before us in this interim that I haven't had an opportunity to really think much about what we're going to be tackling from a substantive point of view in my committee. I have consumer protection and health. I know there will be some consumer protection issues. I know there will be some health issues. So I'm going to be trying to look for those things that we can do from a policy perspective that don't need additional money, or ways that we might be able to consolidate programs, get some off the books that we don't need any longer, so that they're not soaking up resources that could go elsewhere. That's what I'm going to be looking for.
Oh. Kurt, you want to go?
Okay.
I'll
Go ahead. So,
okay.
you can go.
I'll try my hand. I really feel that we've got to give a voice to the vulnerable, those in the smaller arts and family care centers, and looking at how we might do that without additional funding, as we know is limited. But I know that there are federal funds that come to those programs, and Roz, maybe when you start talking to Keith Ridley to see what kinds of things we can do, but to really streamline that, maybe coordinate with the Ombudsman program, because they do outreach to those 1,700. And so I'd like to see that as a priority, because I think those are the people who, during the pandemic, and it's going to go 2, 3, 4 more years until we get the vaccine, to test and really support those smaller homes that have a number of vulnerable that they're serving. So I'd like to see that. Of course, Kupuna Care, but again, all the money bills and the policy kinds of things. And it's not just one, but the policy things, all for the vulnerable, because they really have no voice. So I think it's up to us to find a way to support those policies. Thank you. I hope that the Kokua Council starts helping in framing those. So thank you.
Mine would be for this, if I could do first responders, making sure going forward that we have protection for them from the from the adult correctional officers, HPD, fire department, our nurses, our doctors, just everybody in the medical field, and especially our teachers, students, the DOE. Those are the things that I think we need to change. Even though we don't have funding, I think we can change policy in a sense of making sure that these things are taken care of. Even right now, for when we try to reopen the schools, even at now, we don't have one set policy coming down from the DOE saying this is how we're going to do all the schools. This is the mandate that we're going to do. So this is something that we need to do legislatively, working with the governor and the DOE and our first responders, that everything, now that we're learning from this and prioritize it, to make sure that we have a policy in every area of response, from the Department of Health, responding to these issues at the certain areas, but we need policy. It doesn't cost money for policy. We just got to make sure that it's in place, that these things can be proactive instead of reactive. Because right now, we have our schools opening slowly, and we have people getting sick and dying. We're getting people going, working at the prisons, getting sick and dying. Same thing with our first responders. So we need to make sure the policy is in place, and we need to also work with the governor to give guidance to how this policy should look like in every department. Because without the policy and implementing these policies going forward from the legislation, whether it's the House or the Senate, we're not going to be able to protect our people if we have another pandemic. We're not even through this one yet. And we don't even have a strict policy from the leadership down saying all the states, all the counties need to come under this policy. This is one policy, one act, one rule. We all need to get together and get on the same train. And that's how we're going to get this pandemic that we're going through now, not gone real quick, but that's how we're going to get a hold of it if we have a policy from the top down, side, forward, whichever way you want to go, to be in place so that the teachers know what they're doing, first responders know what they're doing, and going forward and so on. Because if we don't, we keep pissing, we keep pissing, here and there, we're not going to be able to solve anything but cause more confusion. So going forward, that's what I want to work with my colleagues and even with the House of Representatives to see if we can come and maybe come together. That doesn't cost money, to come together collaboratively and work on each department, each area that I just talked about, a policy going forward. If this pandemic continue on, we need strict policy, strict guidance so that we can open up and we can be not only successful, but we can get less people getting sick and die. That's something that I really think I'm going to be passionate about working with my colleagues going forward. And I know Senator Baker and MORIWAKI feel the same way, the passion that we need to save, keep our people safe. I'm pretty sure. Thank you guys. Thank you, Senator Baker and MORIWAKI, always working closely with me and giving me guidance. Appreciate you guys' help.
Well, going back to the original question, and as speaking as co-chair of the Kupuna Caucus, I think I'm hoping that the caucus will rally behind the need to sustain the Kupuna Care program funding at least the current rate of $9 million a year. We know that frail elderly want to live independently, and it's the safest place for them to be, especially with the COVID pandemic. And it makes economic sense for us to enable them to live independently. So we can talk about the kind of services that we provide for them within Kupuna Care, but bottom line is I think we need to find a way to continue funding for Kupuna Care. Thank you.
My priority for 2021 is a passion for saving lives and saving our livelihoods. Basically, it's a recovery plan. First, for saving lives, I mentioned earlier the spit in a cup test. I would hope that we would passionately form a pharmaceutical industry by rallying behind Oceanit, which has, as I said earlier, a 10-minute test, a $20 fee, and one that we can have quickly and inexpensively, COVID-free flights, COVID-free hotels, COVID-free schools, and COVID-free workplaces. That testing is, to me, a priority, and I hope you guys that heard the good presentation before the Senate committee, for the $10 million, if you guys would have had a checkbook on your desk that day, I think they would have got Patrick Sullivan would have got his payments. I think one of the best things that we can do between now and spending that money by the 31st of December is to get Patrick Sullivan and his good Second thing is, the co-chair of the Small Business Caucus, we've got to make our businesses survive, alive, and get back with their employees. We've got to get people back to work. So I'm hoping that we can incentivize these guys to get back up on their feet, bring their employees back, and hopefully get enough market, i.e. with our open economy and with our existing economy, to survive and thrive to where we were before. We were doing very well. We're going to have a change in the complexion of tourism, so to speak. We're probably going to less and more upper linkages. We may even charge more fees for different things, like we're talking about Hanama Bay now, going from $7.50 to maybe $12.50, something to that effect. We're going to be looking for ways not only to cut money, but also to increase revenue. But basically, the passion I have for 2021 is recovery. And again, I'm confident we can do it, and we will throw this virus on the ash heap of history. But thank you guys for bringing our attention to a lot of the Kupuna issues. It's been an honor being part of this discussion, and I know we've gone over by 35 minutes, Madam Chair, Lila. So thank you all, and aloha.
Is there any representative or senator that would like to add to Jean Dobashi's question about priorities for 2021? If not, let me turn this over to Justin Wong, President of HARA, to do his closing statement, and then I'll follow Justin with my closing statement. Justin?
On behalf of HARA, I would like to thank everyone who participated in this 2020 legislative review. hopefully our next legislative review will happen in May in 2021, as we have had in previous years. We're looking forward to seeing you until then. Thank you very much.
Thank you, Justin. Mahalo to our legislators for participating in the 14th Annual Legislative Review by Hawaii Alliance for Retired Americans and Kokua Council. Mahalo to our colleagues in Hara, whose collaboration with Kokua Council produced today's program. We invite you all to join us at Kokua Council's annual community forum later this month when we discuss and determine Kokua Council's 2021 legislative priorities. It was a very educational, enlightening, instructional, I don't know what words to use, but I really appreciated this, your participation, legislators. Mahalo to the public too for joining us today. We hope that all found this session informative and the public are motivated to participate in the legislative process to ensure that our voice is heard and our rights are protected. Finally, for everyone, when you receive your ballot this year for the general election, please vote and please return your voted ballot by U.S. Postal Service no later than October 27th. After October 27th, please return your ballot to a voter service center or drop box in your county. To legislators, to members of HARA, members of Kokua Council, thank you for your participation. It was a very interesting, exciting session. We look forward to what you have in store for us in 2021, and we will be sharing with you at the end of our community forum what our priorities are. Thank you for joining us. I'll be ending the meeting. Mahalo.
Mahalo and aloha.
Aloha.
Aloha. Aloha.
Thank you. Mahalo.
Thank you.